So why is it that we don't engage in the healthcare decision-making process? I believe it's because of those 6 words. Your insurance will pay for it. And that, my friends, is what I wanted to talk to you about today. Healthcare in America will never be affordable until each and every one of us become engaged healthcare consumers. I call it an EHC. And I'm hopeful that years from now the term EHC will be common, because until each of us own becoming an EHC, healthcare will never be affordable. Let me share a story with you, and if you're a parent, you'll be able to relate to this, but it's your 16-year-old daughter's birthday. She just got her driver's license. The insurance is all set up. She went on the internet and printed out the exact car that she wants to get. She jumps in the back seat. Mom and Dad jump in the front seat. You drive down the street. You get to the stoplight there on Auto Center Drive, and you just hear your daughter's excitement in the back seat. There it is, Dad. The exact car I want. Same color, same radio station and everything. Sticker price, $16,000. We're sitting at that red light. We're so excited. Mom looks over to the right and says, there it is on this side of the street too. Same color, same radio station, exact car, sticker price, $42,000. So here's the moment of truth, folks. Which way are you going to turn? Most of us who are dads, the dads I know, are going to, if it's your own money, you're going to turn left and pretend like you didn't hear Mom, right? Why would you pay 60% more? But you know where I'm leading you here, don't you? When the insurance is paying for it, let's turn right and ask what the difference is. There's not one thing different from the car on the left and the car on the right but the price. So let me ask you this. Can you think about a time in the last 20 years where you needed to go to the hospital or to go see a doctor, and because you knew that the insurance was paying for it and your co-insurance was the same at either hospital, you just picked the best hospital and went without knowing the consequence, didn't you? It's happened to almost all of us. The prices I used for those cars are identical to some surgeries in a hospital. Hospitals on opposite sides of the street, believe it or not, with the same doctor operating on you on the left side of the street that would operate on you on the right side of the street. So until you become an engaged healthcare consumer, costs will continue to go up, and here's the reason. When you chose the $42,000 hospital, which we all do, that's what we were trained to do, you did pay for it. You paid for it next year when there was a premium increase, because guess what? The other 500 employees at your company also chose the more expensive option because your insurance will pay for it. So until we become engaged healthcare consumers, that will continue to happen. Let me tell you what your employer will do. If you engage in the process and choose to go to the hospital on the left side of the street, they might actually say, we will pay your $1,000 co-payment because we will save $20,000 by you going to the hospital on the left, we being your employer, and we won't have to pass it on to you next year.